Air pollution is a public health emergency in India, but also in many other countries. Over the years, we have seen that air pollution has been growing as a risk factor for health. And so we need to start responding to it also as a health issue. Just as we responded to COVID, which of course was a virus, but it was a pandemic, everyone acted together, well coordinated, there was a well thought out plan of action, there was a governance mechanism, there was financing, there were tools, solutions, and there was accountability as well. Similarly, I think the time has come to really look at air pollution, and when we say air pollution, there are many components which are very harmful. All of us know about PM 2.5, which is small particles, and PM 10, which is mostly dust. But there are also very harmful gases that are released into the atmosphere from burning of waste, from industrial emissions, and other harmful industries like sulfur dioxide, nitrous oxide, ozone, methane, black carbon. And all of this together actually, forms a very toxic mix. We have seen the increase in non-communicable diseases in India, whether it is chronic lung disease or lung cancer, diabetes. More and more we are seeing cases of neurological diseases, dementia, and particularly worrying is the impact on young children, pregnant women and young children, because there the baby's organs are still developing. So exposure to air pollution early in life will have lifelong health impacts. The good news is that we can do something about it. It is not an insurmountable problem. What we need are a few things. First is that we need an agency or a body that is handling the pollution, or even this is true for other environmental health hazards as well. It has to be very well equipped scientifically and technically, because the approach to handle air pollution has to be based on science. Secondly, we need effective governance. There needs to be some kind of a empowered body that cuts across administrative lines, because we know that air is common. It's not limited by city or state or even country boundaries. So if you want to address, just like pandemic, we had a global plan, we had a national plan. So we need a plan that, and the responsibility and the authority given to a group of people who can operationalize and implement that plan across state and city boundaries. Thirdly, it would require financing. It's a long-term plan we need to make. This is not something that will be achieved in one season or 2 seasons. But the investment we make today is going to pay back many-fold in terms of both health and economic benefits. So it's worth investing in it. And fourthly, this particular body will also need to have accountability. And because today actions are spread across many different sectors, the accountability is not clear. So if you centralize that into one body, and the body could be a national body with regional airshed-based bodies, because pollution is not a city or a village or a rural or urban issue. It is based on air sheds, and I think our understanding of air sheds now is quite good. A lot of analysis has been done. So we could have a body that looks at air sheds in different parts of the country, but of course they should all be coordinated perhaps by a national structure, which should be again a science-led body. It should have experts from health, from climate, from environment, from civil society, and of course from government as well. So I think this is very doable. I think the time is right, and I think that India can actually take a lead globally by demonstrating that it's possible to come even from these high levels that we see today of air pollution to something that would have huge public health benefits.
Ma'am, if this will not be done at this time, how awful is this?
There is enough data now to show that air pollution is actually making us lose about 3% of our GDP. That's the kind of huge economic impact it's having, because it produces ill health, it produces loss of productivity. It also has other implications. In fact, it affects agriculture as well, because when you have a very thick smog, the sunlight is not going to reach the plants, and so plants cannot make chlorophyll, they cannot have photosynthesis. It affects tourism, it affects investments, So it has very far-reaching and profound impact. But for me, the most important one is the impact that it's having on